Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I am a gerontologist in St. Tammany Parish, and I've been partnering with the Council on Aging in St. Tammany for 10 years as a caregiver support group facilitator. And of course, I've been involved with this Caregiver Coffee for 5 or so years. And if you've seen these Caregiver Coffees before, that's wonderful. If not, I want to tell you a little bit about them. So the purpose of them is to be able to give education to all of those who are out there in social media to talk about common health tips for older adults. We talk about caregiving. We talk about remaining independent as long as it makes sense and staying in the setting that you want to stay in for as long as it makes sense. So for most of us, we all want to be, for most of us, we want to remain in our homes, right? And only go to live outside of our home if need be for safety. So that's the kind of stuff we talk about here on Caregiver Coffee. So I'm glad that you're here. Our topic today is going to be on depression, specifically in older adults. And before we get to this important topic, just a few things, a few plugs for the caregiver support group that I usually do before all of these because it is important, right? And some people may only watch one video, so we need to talk about it. So the support group that I am blessed to facilitate is every Tuesday evening from 6 p.m. Central to 7:30. Sometimes we're in person, sometimes we are on the Zoom platform, so online. And the way that the month works is that the first Tuesday of the month, I'm at Slidell Senior Activity Center from that 6 to 7:30 time. The second Tuesday of the month, we're online, and you can join using your landline phone. You can join on your computer. You can join on your smartphone, whatever is most convenient and technologically easy for you. The third Tuesday of the month, we are in person again, and that's at the Covington Activity Center. And then on the fourth Tuesday of the month, we are back online. And then sometimes a month will give us a fifth Tuesday of the month, and sometimes we meet, and sometimes we take a break for that week. It just depends on getting the green light from the Council on Aging in St. Tammany. So if Tuesday falls on a holiday, so if Christmas falls or 4th of July falls on a Tuesday, we end up deferring to later in the week. Of course, Mardi Gras is always on a Tuesday, so we defer to usually the Thursday after the day after Ash Wednesday. So a way that you can find out for sure when we're meeting is to go to coastseniors.org and go to caregiver services or resources, and you'll be able to download the 2-month flyer that we have. So we publish it every 2 months, and there you'll see the address, you'll see where we are, you'll see the Zoom link and the phone numbers if we're online. And I also send an email if you give us your email address, and we'll show you how to do that on the flyer. You join that, you'll get a reminder on the Tuesday morning of the group wherever we are. So, all right, with that all done, all that housekeeping, let's talk about depression in older adults. And as usual, I'm going off of a great article from the National Institutes on Aging. And it's kind of a long article. We'll see if we can cover it here in these 10 minutes that we have remaining. If not, we'll split it up. But I certainly will put the link in the video description so you can go to it because there's a lot to this one and there's a lot of good hyperlinks. So I encourage you to do that, to go there. All right, so feeling down every once in a while is a normal part of life. But if these feelings last a few weeks or months, you may have depression. So read on, or in this case, listen on, to learn about depression in older adults, common signs and symptoms, treatment options, and other ways to provide support. So what is depression? It's also known as major depressive disorder, and it's a serious mood disorder. It can affect the way that you feel, act, and think. Depression is a common problem among older adults, but it's not a normal part of aging. In fact, most older adults feel satisfied with their lives despite often having more illnesses and physical challenges than younger people. Depression is serious though, and the treatments, it can include counseling and medication for help. For most people, depression gets better with treatment. So it's important to let your doctor know if you feel depressed. And it's likely that your doctor, if they're doing the full exam, they're screening you for depression with 2 questions. And then if you test positive in that, they'll do a further assessment right there, and that doesn't even take long. But it's important to answer those accurately. So there's several types of depression. And we'll go over 4. There's major depressive disorder. This includes symptoms lasting at least 2 weeks that interfere with your ability to perform tasks each day. There's persistive depressive disorder, and this is a depressed mood that lasts more than 2 years, although a person may still be able to perform daily tasks. There's substance/medication-induced depressive disorder, and this is associated, as you might expect, with substances, with abuse, with withdrawal from substances such as alcohol or pain meds. And then the fourth major one, is depressive disorder due to a medical condition, so related to a separate illness such as heart disease or multiple sclerosis. And see here, there's a link to the different types of depression from the National Institutes of Mental Health. So that article is going to be more broad than just older adults. It's important to reach out if you need help. If you're thinking about harming yourself, please tell someone who can get help for you immediately. Do not isolate yourself. Call a trusted family member or friend. Call 911 or go to the emergency room to get help, and make an appointment with your doctor. There's also, this might be the first step, is calling the 24-hour 988 suicide and crisis lifeline. So you can just like you would dial 911, you can dial 988. There's also an 800 number, 800-273-TALK. That's 8255. So please do that if you're feeling depressed, if you feel like you might harm yourself. There are trained people on the other end that will, be able to talk with you, and just, even if you feel like you're in free fall and there's no, and nothing makes sense, call that number, 988. So what are the risks for depression? There are many risk factors that increase someone's risk. For example, changes in the brain can affect mood and result in depression. Others may experience it after a life event, such as a major medical diagnosis, the death of a loved one, etc. So sometimes those who are under a lot of stress, including those who care for a loved one who are aging or have an illness or disability, can feel depressed. And in some cases, depression happens just for no reason. Research has shown that these are the factors related to the risk of depression. A medical condition such as stroke or cancer, a personal family history of depression, stress, including caregiver stress that we just talked about, sleep problems, social isolation and loneliness, lack of exercise and physical activity, functional limitations which make engaging in activities of daily living very difficult, and alcohol use disorder. Everyone needs social connections to survive and thrive, but as people get aged, they often find themselves spending more time alone. And studies show that loneliness and social isolation are associated with higher risk of depression. So if you're feeling socially isolated or lonely, try to connect with others and engage in a meaningful way. And there are several ways to do that, especially if you belong to a church or faith-based organization. There you already have built in, maybe it's a fraternal organization or a veteran association, or the Council on Aging, and going to the senior centers a few times a week. What are some of the signs and symptoms of depression in older adults? Depression in older adults can be hard to recognize. For some, sadness is not actually the main symptom. Instead, you could feel an emotional numbness or a lack of interest in activities, or they may not be as open to talking about their feelings as younger adults. Signs and symptoms can look different depending on the person and their cultural background. People from different cultures may express different emotions and moods, including depression in different ways. In some cultures, depression may be displayed primarily as physical symptoms such as aches, cramps, headaches, pains, and digestive problems. Persistent sad, anxious, and empty mood. All right, so sorry. So we're going to like sort of a large list of symptoms. So we'll pay attention to this when we think about ourselves or others. So that persistent sad, anxious, or empty mood, feelings of hopelessness, guilt, worthlessness, or helplessness, loss of interest in once pleasurable activities, including sex, decreased energy or fatigue, moving or talking more slowly, difficulty concentrating, remembering, and making decisions, ignoring important roles in life, such as responsibilities with work and family, difficulty sleeping, waking up too early in the morning or even oversleeping, eating more or less than usual, usually accompanied by unintended weight gain or loss, increased use of alcohol or drugs, or engagement in high-risk activities, thoughts of death or suicide attempts. If you have several of these signs and symptoms and they last more than 2 weeks, talk with your doctor. These could be the signs of depression or even a different health condition. Please don't ignore these signs. They're very serious. So how do we support friends and family with depression? As a family member of someone with dementia, here are some things that you can possibly do. Encourage that person to seek medical treatment and stick with the treatment plan, even when things get better. So if medicine is prescribed and it's working, continue to take it until the doctor says that it's no longer needed. Help set up medical appointments and accompany the person to the doctor's office or to a support group. Participate in activities that the person likes to do. Ask the person if they want to go for a walk or a bike ride. So physical activity can be amazing for preventing or even treating, being part of the treatment plan for depression. Listen for clues that the person may be feeling worse. So such as feeling sad or numb, empty, or for long periods of time. Don't shy away from asking a family member or a friend if they're feeling depressed or suicidal. It may be uncomfortable, but it is important. Asking someone, this is very important because most people don't realize this. Asking if someone is having thoughts of suicide will not make them more likely to act on those thoughts. This is actually, the way that they respond is very important. You could be the one that discovers this and is that, they see you as seeing that cry for help that they have. Your questions may help open up the person into how they've been feeling sad and encourage them to seek treatment. And remember the 24-hour suicide crisis lifeline is 988. So how is depression treated? Depression, even severe depression, it can be treated, even if it doesn't feel like it, or even if you don't feel like there's hope that it can be. Treatment should start as soon as you see signs. That's why it's important to jump on it before things get worse or just more entrenched. Certain medications or medical conditions can sometimes cause depression. A doctor can rule out these possibilities through a physical exam, learning about your personal history, and doing other tests. If a doctor finds that there's no medical condition that might be causing it, so kind of ruled out all the things that they may think of, they may suggest a psychological evaluation or refer you to a specialist such as a psychologist or even a psychiatrist. So here are some common forms of treatment for depression. They include psychotherapy, medications, electroconvulsive therapy, and repetitive cranial magnetic stimulation. And I'm going to go through each 4 of those very quickly as we wrap up. So psychotherapy, this is counseling or talk therapy. This can help a person identify troubling emotions and change those emotions, thoughts, and behaviors. It can be done through a psychologist, a licensed clinical social worker, a psychiatrist, excuse me, or a licensed mental health care professional. Examples include examples of approaches to treat depression include CBT or cognitive behavioral therapy or interpersonal therapy. There's medication that may help balance chemicals in the brain, such as serotonin that affect mood. Selective serotonin reuptake inhibitors, or SSRIs, and are antidepressants that are commonly prescribed to older adults. A psychiatrist or other professional that prescribes medicine may prescribe that and help monitor medications and the side effects. Electroconvulsive therapy, or ECT, is when electrodes are placed on the person's head to enable safe microelectric currents to pass through the brain. This therapy is usually considered if the person's illness is not improved with other treatments. This does sound scary, and I do not have any experience with this, but I have heard a professor, a geriatric professor that I respect very much, talk about ECT. So I would encourage you to do more research if this sounds like something that you may be a candidate for. And they'll kind of walk you through this, right? So therapy, if therapy is not working completely, the next step is medications. If the medications are not helping, ECT might be appropriate. The last one is repetitive transcranial magnetic stimulation, which uses magnets to activate the brain. It does not require anesthesia and targets only specific regions of the brain to help reduce side effects such as fatigue, nausea, memory loss, and sometimes happen with ECT. So with that, there's a lot of information. This is a great article, and there's even a more general article on depression in older adults that has some infographics and things like that. So I highly suggest that if you see any of the symptoms that we talked about in yourself or in others, that you take action. Don't delay on that, because what's the worst that can happen is that you might offend someone if you say it the wrong way, but then if they're depressed, you might get them on the road to recovery. So it's worth having the courage and taking that step if you see that. All right, and we will leave it there. We're going to talk about other mentation topics for older adults. We'll talk about dementia. We'll talk about delirium. We'll talk about anxiety. All very important things. So thank you for sticking around for this, for all of this information. I know it was a lot, but thank you for sticking around for this Caregiver Coffee, and I hope it helps you and others in your life. Thank you for being here. Thanks for sharing this, and I look forward to being on your smartphone or your computer on the next Caregiver Coffee. Take care.